Hi, welcome to ThinkTech Asia, coming to you from downtown Honolulu. I'm your host, Hong Jiang, Associate Professor of Geography at University of Hawaii at Manoa. And my guest today is Ms. Kristine Altwies, Executive Director and CEO at Hawaii International Child. And today we are dealing with a very fascinating, mind-boggling, and challenging topic of surrogates in India. And Kristine, thank you so much for joining us.
Thank you for having me.
So last time, it was back in May, we had you come here to talk about adopting from China. And although there were challenges there, but it was not as complicated as the topic we're dealing with today, surrogates in India. So maybe we'll have you start from the very beginning, because not all viewers are familiar with this whole issue of surrogates and even how it works. So if you could enlighten us about surrogates.
Sure. Okay, so surrogacy is a relatively new way of family building, and surrogacy became possible following the advancements in reproductive technology and people creating embryos in the lab outside of the female body. So with surrogacy, what you have is women offering to carry a baby for a couple or an individual who can't become pregnant herself. There are two types of surrogates. There are gestational surrogates and there are traditional surrogates. Traditional surrogates are women who use their own eggs and carry a baby which would then be 50% biologically theirs, and they are inseminated with someone else's sperm, another man's sperm.
So the egg is coming from the surrogate mother?
Yes.
Okay.
So that's a traditional surrogate. Mm-hmm. And those kinds of surrogates are rare. Usually those are informal relationships between sisters or good friends. Most upstanding organizations, agencies, facilitators, medical clinics won't participate in that type of surrogate arrangement. Mm-hmm. And those types of surrogate arrangements are not the type we're talking about taking place in India. The second type of surrogate is one who is a gestational surrogate. A gestational surrogate means a woman who is implanted with an embryo that has been created in a lab. So the gestation period of the egg and the sperm has been created, an embryo has been created in a lab, and that is then implanted in the surrogate, and she carries that embryo, that baby, to term.
How long has the surrogacy as a technology been in existence in the U.S., in Hawaii?
Yeah, so it's relatively new. It's new technology, relatively speaking, in terms of sort of the history of mankind and how people build families. Traditional surrogates are not so new. Those have been around for many years. As I said, informally, I think probably years and years and years ago, when women couldn't get pregnant, they may have asked a sister, and maybe a sister would have had relations with, a woman's husband just to have a child for that woman.
And of course, traditionally, you also have adoption from relatives as a way to extend the family.
Right,
yeah,
right.
That's much older.
Exactly.
Yeah,
so
yeah.
What we're talking about today is this relatively new boom industry of gestational surrogates in places like India and now starting in Thailand.
So how did it get to India? I mean, to Thailand? How did this surrogacy as an industry start to expand to, other countries?
That's a great question. I think that if you have ever spent time around women who couldn't have and didn't have children and felt the energy and the drive and the sheer determination of those women to become mothers, it is a powerful force, as we talked about last time with the adoption question. It is an industry that I guess was just sort of waiting to happen because India has, in the past decade or so, become a medical tourism hotspot. And with medical tourism, initially I think probably as a place where people were going for maybe plastic surgery more often than not, It was cheaper there than in the US. India is known for a fairly good educational system, higher education. So I think a lot of doctors, even a lot of US doctors we have are born and educated in India. They have fairly decent medical facilities in terms of other third world or developing country comparisons. And the most important factor, I would guess, has to do with the cost.
Mm-hmm.
If you compare the cost of a surrogate relationship in the US with that of one in India, you'll find that the price in India is probably about a third what it would be in the US.
Can you give us some examples of the cost of a surrogacy both here and in India or in other places?
Sure. The cost, so the number of costs are to be considered. One is the cost of the medical procedures, so extracting the eggs, doing the hormone treatments, creating the embryo in the lab, having the sperm, and then injecting or implanting that in the surrogate. That's one of the costs, so the medical costs. And along with those costs come the costs of harvesting the egg from the intended parent or the donor, the egg donor. Then you have the cost of caring for and treating the surrogate mother for 9 months. It usually amounts to probably more like 12 months because she has to be given hormones and put on a cycle to make sure that her womb, her uterus is ready for implantation. Then you have the cost of travel, the legal costs.
That's right.
So all in all, the estimate of a cost of a typical surrogate procedure in India would cap out at about $30,000.
That would be similar to adopting a child, right?
That's about what we estimate adopting a child often costs in the US or elsewhere. Now the $30,000 doesn't take into account the failed procedures. So for 25,000 families who went to India to seek a surrogate arrangement, the numbers are that about 2,000 succeeded in bringing home a live baby. So that's about 10%.
Wow, that's very low.
That's very low, but if you're talking to a couple or an individual who is focused on creating a family, they will take those odds and they will say, at least that's something that I can work with. So you add to the 30,000 maybe a second try or a third try, the price can go up. The thing to keep in mind is that the costs of medical procedures and medical work in India are a fraction of what they are here. And the payments or the compensation, the reimbursements to the surrogate mother in India range from as low as $2,000
for carrying the baby for 9 months, $2,000.
From $2,000 to about $8,000. So about 5-6 is average. In the US, a typical surrogate mother would receive a minimum of about $20,000 and then additional payments for additional procedures. So if it's a twin birth, if it's discovered that she's carrying twins, then usually another $3,000 is added to that. If she has to go through multiple medical procedures or multiple implantations each time, she receives money. If she has to be on bed rest, she's given additional money. If she has to have someone helping her care for her children or clean her house because she's on bed rest, transport. So in the US, the surrogate mothers are compensated appropriately.
Wow. So let's talk about like finding, going through the surrogacy in India. How does it start? The intended parents would go to India, and do they look for agency to work with? Maybe you can enlighten us on the procedures.
Sure. And I just want to say that before we get much further, I am certainly not endorsing the practice of going to India to look for a surrogate. I think that's why we're talking about this, is because it is a very ethically charged conversation, and I would hope that anyone considering it would do their research and would think carefully about all the ramifications.
Definitely, yeah.
So hopefully before you fly over to India, you've done your research. There are apparently anywhere between 1,500 and 3,000 agencies in India right now carrying out surrogacy work for Westerners, for foreigners.
Wow.
Not all of those agencies are registered with the Indian government. So you would do your research. You might engage a facilitator or an attorney in India to help you. And many of these agencies provide a one-stop shop, if you will, where they provide the medical piece, the surrogate mother, and the legal follow-up. So it's up to you how you want to handle that part. You would go over, if you are a married heterosexual couple and the wife has eggs which are viable, which can be harvested and implanted, then you would go over and you would have the medical procedure, which can take a number of weeks. You would receive hormone shots, your eggs would be harvested and then worked on in the lab and then implanted in the surrogate mother. And then you would go home, most likely, for 8 or 9 months and wait for the call.
So the intended parents wouldn't meet with the surrogate mother?
No, hopefully they would. It would be a very cold transaction if they never met the surrogate mother. In most cases, they do meet the surrogate mother and are able to thank them and maybe have some sort of relationship. The thing to keep in mind is that most women in India who would be in a position to need or want to do this would be more economically disadvantaged women.
I can imagine,
and so the social relationship might not be easy or comfortable for both sides, something to work at, but certainly the mutual respect and gratitude is, I would imagine, usually very present.
And language barrier could be present there, right?
Yes, the vast majority of these women, from what I understand, are day laborers, house cleaners, garment industry workers who earn an average of maybe $500 a year. So for them, the $2,000 to $7,000 is many years' salary.
That's interesting. This is almost like another kind of outsourcing. We have a lot of American companies outsourcing their service part of their business in India, especially in terms of customer service. But this is a kind of a different kind that most people wouldn't even think about. That's very interesting. So let's take a short break, and after we come back, we'll show the photos that you sent us about the surrogates in India. This is ThinkTech Asia. I'm your host, Hong Jiang, and we've been speaking with Ms. Kristine Altwies from Hawaii International Child about surrogates in India. We'll be right back.
I'm Jay Fidel. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the State of Clean Energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the State of Clean Energy, here on ThinkTech Hawaii. We'll see you there.
Hi, we're back. We're live. This is ThinkTech Asia, and I'm your host, Hong Jiang. We've been talking about surrogates in India. So the control room, can we start to show the photos? So if you could, Kristine, explain.
Sure. This is a typical surrogate home in India. Surrogate women following the implantation process, if they are determined to be successfully pregnant as surrogate moms, would live typically in one of these homes. These homes often have 70 to 80 women living in them in these dorm-style rooms. Keep in mind that for most of these women, this lifestyle is an extreme upgrade from what they're used to. In order to be a surrogate in India, you must be married and have given birth to and raised at least one, typically 2 or 3 children. So the challenge with this situation is that these women are living away from their families and away from their children. By definition, they have to be young women. They can't be over the age of 35. So that means they most likely have young children at home who are missing them.
Wow.
But in these homes, they are able to make deep friendships and form bonds with other women who are going through this like they are.
Is it by law that these women have to be in these kind of surrogate homes during the whole 9 months?
It depends on the agency. Some of the agencies require that the women live there so that they can be monitored, so that they can receive proper nutrition and prenatal care. Many women in India do not have prenatal care during pregnancy. So this is by some folks who are proponents of Indian surrogacy seen as an improvement to the lifestyles for these women because they are receiving care here and good nutrition.
Wow.
In some situations, in private surrogate relationship arrangements, the women are allowed to live at home.
I see. Next photo, please.
These are some women waiting for their exams at a surrogate facility.
These are the women who are candidates?
Yes, these women are all pregnant. You can sort of see that they're pregnant there, and they're waiting for an exam to monitor the pregnancy in a surrogate agency.
I see. So they are already surrogate mothers.
Yes.
Okay. Next, please.
Yeah, this is one of the many articles that has come out in the international press. Many of the articles have been in favor of this booming industry, and just as many articles have come out criticizing it.
It's definitely a controversial issue. We're going to explore some of these issues later part of the program. Next, please.
This is a birthing room. This is a medical room similar to what we would have here at Queens or Capilani Hospital, where the women go to give birth. And as you can tell, it's a bit austere and lacking in a lot of the warmth and comfort that we have here at Queens or Capilani, but this would be a typical sort of nicer delivery room in India.
Next, please.
Here you see more surrogate women living in a dorm-style surrogate center. Beds are very close together. They spend a lot of time resting and hanging out and talking with one another.
Okay, next, please.
I believe this is a Western-style birth and delivery room in a Western hospital to just show you the contrast between an Indian delivery room and a U.S. or Western style.
It's brighter looking.
Brighter, there's more technology in the room, the bed's more comfortable, and you can see that the birth mom or the mother would spend more time in there. The Indian delivery rooms tend to be rooms that you sort of come into, give birth, and quickly leave.
Wow. Next, please.
Another Western delivery room. The beds cost, I guess upwards of $100,000 each in the U.S. or in the West. Again, very different, much brighter, a lot more technology.
Yeah, next, please.
An Indian delivery room, by contrast.
Wow, this is a sharp contrast. Yeah, next one.
Another Western. The Western delivery and birth rooms are becoming more and more comfortable as time goes on. There's a lot of emphasis on making place for family members to sit and hang out and provide support to women who are giving birth.
Next, please.
This is in India. Here on the left you see an Indian woman wearing an Indian sari, holding one of the two babies she gave birth to for, I believe this woman is Canadian. Those two babies were delivered by the surrogate for the intended mother who's holding one of the babies.
And this is twins.
Yes.
Okay, so it's really interesting just by looking at the contrast of the two kinds of delivery rooms, and also how women, the surrogate mothers, live there, often could live there, that there are already a lot of issues there. So I want to ask you some questions before we get into exploring some of the issues there. So first of all, these mothers needed to be young mothers, the surrogate in India. And has there been kind of more information about the kind of conflicts that would, or issues that would create with a woman's family, like if she's away from her child, her own family, what kind of experience that was.
Right, sure. Important to note that obviously India is a wonderful country, rich in history, with many cultural assets and advances, and culture that is certainly laudable. So the women that we're talking about are not necessarily representative of the best that India has to offer, insofar as these women tend not to be highly educated. They tend to be rural women. They tend to be women who are manual laborers. Wonderful women. I don't mean to say that by not being educated they're not just as valuable and wonderful, but for them the surrogacy process may be life-changing. And that is how many of the proponents of this industry discuss it. They want the critics to focus on the fact that it's easy to sit back and say that this may not be a good thing for someone to take on, but when you can buy a house for your family as a result of 1 year of work, or when you can provide education for your children and therefore sort of move the family up through society a little bit, it's hard to argue, some would say.
I see. And maybe the family members and the husbands and other family members have come to accept the risk, accept what they have to pay in order to get the
In some
advancement.
cases, the critics are concerned that the women become the pawns of the husbands, that many times the husbands are pushing their wives into becoming surrogates to help the family.
Okay.
On the other hand, there have been many Indian surrogates that I've read about who are embarrassed and ashamed to be surrogates, and they hide it from their family. They hide that they have left to do this. They don't want to be interviewed. They don't want anyone to know they're doing this. I've also read about women who are doing this completely confused about what it actually is and how it works. For some women, the idea that you could be pregnant without having had relations with a man makes no sense at all.
That's right, yeah.
And they don't understand the medical technology that they are intimately involved with.
And after they decide that they're going to become a surrogate and they carry somebody's baby, then their life is not under their control anymore. They need to listen to the doctor's instructions, right? They can't just go home and go to the village and continue their life as it was.
Right. If the birth goes well, and many of these women have given birth 3, 4, 5 times already, and they're young and healthy, if the process goes well and the birth is uneventful, then within a few weeks of giving birth, they will go home. But their lives are forever changed, and many of them talk about the emotional trauma of missing the child and missing the relationship with the child they've developed through the pregnancy. And I don't imagine that many of these women have the opportunity for follow-up or long-term counseling. And they're going back to a place where either people don't know they've done it or don't truly understand it. And many of them have to go right back and pick up where they left off, caring for a family, working long hours, working 7 days a week.
And I wonder if their neighbors, villagers know about what they were doing, whether there's any kind of, negative views about them, that would be another social issue for these women.
Quite possibly.
Yeah, wow, that's just unthinkable. And there are actually, do you have figures in terms of how many surrogate mothers there are in India?
I think that from what I understand, there are more surrogate mothers or more women who want to be surrogates than there are women who are actually working as surrogates right now. So I understand that there is no shortage of available and ready surrogates in India. They say the most recent numbers are that about 25,000 foreigners go to India every year for surrogacy.
Oh, wow.
So if you consider that, and then probably you have twice as many surrogate mothers working at any given time, getting ready, going through the hormone treatments, going through the testing that's required in order to become an eligible surrogate, takes a bit of time, psychological testing and interviewing before they can be accepted by whichever agency.
So in terms of, let's come back to these surrogates, these surrogate mothers in India. So after they deliver, they go home and try to have their normal life. And then they may come back again to have carry another surrogate child.
Yes, it's not uncommon for a woman to do this multiple times.
Wow, wow. I'm just wondering, you know, there are definitely a lot of work that need to be done, research need to be done to understand the impact on these women, but it probably is also very hard to get the woman to actually openly speak about this experience.
Right, right.
Yeah.
It's not something that people are used to talking about. We don't have the social or vernacular vocabulary to talk about this, and probably less so in a rural place, in a place where sort of, you know, trying to provide for your family is the major focus of every day.
And here, in terms of technology, we're jumping many different levels through many different years to get from the rural living condition and the kind of technology and lifestyle of you know, rural India, where these women live, to understanding this new technology that started in the cities and still not a lot of people are using, to think about it's involving something that's so intimate as a woman's body.
Yeah.
And that's probably very confusing, as you mentioned, to these women, although they make money from it, but what kind of a cost there is, you know, I don't want to compare it to other forms of, you know, woman labor setting the things related to their body, but again, it's really also about, you know, using their body to make money.
Right, and it's about equality. It's about, you know, I mean, it's about who has the power and who has the money, and you know, what will people do to support their families.
And this phenomena of surrogate in India is how long it's been? Is it like decade or?
I don't know exactly when the first case was, but I know that the industry as such has boomed since about 2005, is when you started seeing large numbers. Recently, there were some efforts on the part of the Indian government, which we can talk about after the break, to try and put some regulations in place to protect the women.
And because it's so new, and we have to wait and see the kind of long-term impact on the woman, especially the surrogate woman. That's interesting. Okay, let's take another short break. This seems to be a right time. This is ThinkTech Asia. I'm your host, Hong Jiang, and we've been talking about surrogacy in India. We'll be right back.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Amashta, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
Hi, this is ThinkTech Asia. We're live, we're back. I'm your host, Hong Jiang. And we've been talking with Kristine Altwies, Executive Director and CEO at Hawaii International Child, about surrogacy or surrogates in India. So yeah, talk about the Indian government policies about surrogacy.
So recently, some of the women's rights organizations in India, and even some of the medical ethics organizations, have introduced some legislation which would protect the surrogates a little bit more and try to put in place some of the basic legal constructs that are currently in place with, say, inter-country adoption. So right now there is absolutely nothing on the books in India which would say, for example, that a family doing this would have to show that they are equipped to parent a child. In inter-country adoption, prospective adoptive families have to go through rigorous home studies and various clearances and provide lots of paperwork to show that they are adequate parents, for example. And some of the critics in India are trying to get some of these basic pieces put into place to protect the children. Recently, it was also passed by the Indian government that you had to be a married heterosexual couple in order to do a surrogate birth in India. So previously, I believe there were a larger gay and single population doing surrogacies in India. That is no longer the case so far as I understand. You have to have been married for 2 years, and you have to be a married heterosexual couple. In addition, in order to bring the child home to the US and in order to exit India, there has to be a proven genetic connection between the intended parent and the child. So following the birth, the child would have to undergo genetic testing, and the family would provide genetic material to show that there was indeed a genetic connection. There have been a number of cases where that wasn't the case because the intended parents used donor eggs and donor sperm, and those cases got held up in court for quite a while. But back to the protection of the birth mother or the surrogate mother. In the US right now, for example, a surrogate mother has many rights. She has the right to a certain type of medical treatment. She has the right to certain compensations, or she doesn't have to enter into the agreement. There are also insurance policies put in place that if anything were to happen to the mother while pregnant, if she were to, God forbid, die or be permanently damaged, there are large insurance policies which most families, intended parents, take out to protect the mother. In India, that is not the case. If something happens to the woman during the pregnancy or delivery, I don't believe there are things in place to support her family or to help her. And that's another concern on the part of the critics that they'd like to see changed in India.
Is there any regulation in terms of the money these surrogate mothers would make? You mentioned from 2,000 to, is it 5,000 or 8,000?
The top that I've seen is 8,000.
8,000. And these were paid directly by the intended parents or paid through the medical agency?
Yeah, I think it varies depending on who's involved. Sometimes there may be an attorney facilitating it, but the payments would go through, most likely through the agency or the attorney, from the intended parents to the surrogate mother.
Okay, so the protection. So there, I just wonder in terms of both of the financial aspect and also the health and long-term aspect of the surrogate mothers, whether the Indian government is helping to protect. Apparently there isn't anything about the money side, and there seems to be more rights for the woman, but still didn't, are you aware of any long-term health-related regulations to protect the woman?
No, there are
Still
no
isn't.
long-term health regulations, nor are there any in the U.S. For surrogate mothers.
Okay. So, I just wondered whether there are cases of surrogate mother in the whole pregnancy process or during the delivery, if there's health complexities or health impact on the woman that's long-lasting, then basically the woman's having to deal with, and it's bad luck.
In India, yes. In the U.S., I believe that the insurance policies that are required by upstanding agencies involved in surrogacy would protect the surrogate mother and would give her compensation for injury.
In terms of women's rights groups, do you know what other kind of rights these groups are trying to advocate for the surrogate mothers, and just wonder whether there's surrogate mothers themselves organized to request certain rights?
Yeah, I'm not aware of groups in India of former surrogate mothers or active surrogate mothers banding together to advocate for rights. My sense of it is that women who are doing it are grateful, believe that they're grateful, are told that they should be grateful, are sort of grateful to have the opportunity to earn money for their family. I don't believe that this means that all women who do it are satisfied or are glad in the long run that they've done it. But I do think we have to also step back and give the women who do this on a universal level some amount of credit for making a choice to, in most cases, contribute to someone else's happiness. You know, and again, there are critics, there are proponents. It's a very complex discussion, but I think that many surrogate women who do this service for another woman understand the profound joy and happiness and life-changing experience that comes from being a parent. And that is, you know, ultimately why this industry exists, is because there are women who cannot give birth, who cannot start families, and who deeply, deeply desire to become parents.
And that is a very important point to highlight, because after all, you know, these are women helping women, although through the very unequal social structure, but still, you know, they're still women. And this is probably a good time for us to bring up a control room. Can we have the last photo? It's a photo of a surrogate mother and the intended mother. So this is basically what you're talking about in terms of women helping women.
Yeah, and you know, again, I think it's impossible to overlook the iniquity of this situation. There is no equality here. You know, we have, you know, basically wealthy Westerners, or wealthy by Indian standards. Now, many people who do surrogacy scrape together their life savings. Many people who do this have already gone through countless fertility treatments unsuccessfully, maybe even tried adoption. For most folks, this is not the first attempt at starting a family. So to assume that all Westerners who do this are wealthy, you know, Hollywood stars, I think is false. But nonetheless, by any global standard, there is an inequality here in terms of the social power dynamic. And the Western women, you know, clearly have more than the Indian women. So this relationship is an interesting one. But you know, clearly the Western women are also deeply grateful.
Talk about the relationship. Are you aware of cases where the intended mother continue to keep the contact with the surrogate mothers?
Yes, I think each agency has its own policy controlling the ability for the parties to stay in touch. Keep in mind that many of these rural women may not speak English, may not have access to internet or cell phones, so communication may be challenging. I think many people go into these alternative family building relationships with the best intentions, similar to open adoptions in the US, where we see domestic adoptions and intended parents or adoptive parents intending to stay in touch with the birth mothers, and many of them do hold up their end of the deal and stay in touch. But I think, like anything, you know, there's good intention and then there's reality. I wonder, in the case of the Indian surrogate mothers, are you aware of any study or discussion about the kind of psychological difficulties that they face, because after all, you know, 9 months and they've had the experience of being pregnant, and they see this child as their child, right? And if you know, they've developed that kind of relationship, thinking this is my child, and then the child being taken away, psychological effect of that. Yeah, I know more about the American surrogate situation when it comes to discussion of the emotions and the psychological health of the surrogate mothers post placing the child. In the US, women who tend to be professional surrogates really are, in my experience, proud women who are clearly doing a professional service for another woman. And the way the US surrogate situation is structured is very different from the Indian surrogate situations. So we don't have a lot of long-term data on how the Indian women manage over the long run after placement. I would imagine it has to do with the individual woman and her own mental framework and how she's viewing this.
You use the term professional surrogates. What does that mean?
In the US, the requirements by most legitimate organizations practicing surrogacy is that for a woman to be a surrogate, she has to meet a number of requirements, including the same that would be in India. She has to be healthy and under a certain age. She has to have previously birthed and raised at least one child. And that right there is intended to protect her from overly challenging emotional relationship with the fetus she's carrying or the child. But in the US, the women also, at least again by most reputable organizations, cannot be living on government assistance. They have to have the means to support themselves independent of their surrogacy work. So the surrogacy work is seen as, additional income. And that right there changes the dynamic a little bit. They don't depend on that surrogacy fee for their livelihood. In my experience with American surrogates, they tend to be very proud professional women who take very seriously the job of being a surrogate.
So if they take it as a job, maybe they see it less as a personal kind of experience, but more as a profession.
Yes, I have not been a surrogate myself, but again, in my experience, the women who are the most, in most cases that I've encountered, the women who do this are proud to be doing this as a service.
Okay. And they become less personally attached, maybe?
Which is not to say that it isn't emotionally draining and it isn't emotionally challenging, and that all women who go through it know at the beginning what they're going to experience at the end. But I'm talking about the women who are most evident in the field when you go out and research. The women who are blogging about it, the women who are running groups, the women who are doing it, more than one time, have approached it from a standpoint of mental preparedness.
Yeah, that's what I mean. So if they are psychologically and mentally prepared, then they see what's coming up, and whether the same kind of preparedness existed in India for these surrogate mothers, that would be an issue to really watch and talk about.
Yeah, my guess is it couldn't exist in India because most of these women don't have access to the media, information and research that surrogates in the U.S. would have.
Wow. I mean, there are just a lot of issues here, especially you talk about the issue of inequity and moral issues of what's happening with the Indian woman there. Yeah. So we're going to skip the last break and keep going for another 7 minutes to the end of the program. So let's look at Hawaii, surrogacy in Hawaii. If you could, enlighten us about what's happening in the surrogacy industry and people who are searching for it. How do they go about it?
Sure. Surrogacy in Hawaii, like all states in the United States, is something that happens. A good number of families in Hawaii who are looking to start families using surrogacy are using surrogates in Hawaii. Some are using surrogates in other states of the United States. Some are going to India or Thailand.
Okay. So in addition to India, Thailand, and any other country that become popular?
Yes, oddly, Russia.
Really?
Russia has a surrogacy industry, which at least until recently was also open to gay and lesbian adopting families, which is an interesting issue given the general Russian view on homosexuality at this point. And the Republic of Georgia also has an active surrogacy industry.
And so with these industries, let's say come back to Hawaii, that would be people are they going through agencies like your agency, Hawaii International Child, or going to other agencies to start the procedure, or do they just fly to the different countries?
It's the same as it is with adoption. Folks are using Hawaii agencies, they're using mainland agencies. It really depends. I think often the choice to use a specific agency may be driven by the fees, may be driven by a personal recommendation, may be driven by knowing someone who did a surrogacy with a particular agency. But like the adoption process, we encourage families to get to know whoever it is that's helping them and feel comfortable with that agency before making a decision, because this will be a very emotional and intimate experience.
That's right. With your organization, Hawaii International Child, can you speak a little bit about your involvement in facilitating surrogacy?
Yeah, so we started researching this a number of years ago when we had families coming to us wanting us to help them with surrogates. and we didn't have a program, and many of these couples went off to India. And at that time, we were hearing of too many couples who were just losing lots and lots of money on either failed or fraudulent surrogacy. So we started to look into it. Hawaii has very vague laws about surrogacy. All the states in the Union have laws. Many differ. There's about 10 different types of prevailing law on surrogacy that determines who has the right and when, and whether adoption has to be a part of it, and so on. And Hawaii has relatively vague laws. Our point in having a surrogacy program, which we call My Surrogacy Family, is to use surrogates in Hawaii to give them lots of support, to give them hands-on nurturing and discussions and resources, and to have families in Hawaii. We really like the model of openness and wholesome, nurturing transparency, and make it as human an experience as possible for all parties.
That's right, yeah. Have you started to explore the, might you refer parents who are searching for surrogacy to India? Are you working with any agencies in India?
Absolutely not. No, I
Okay.
would not judge someone for making that difficult decision. I
Okay.
think it's a very personal one, and as I said, starting a family is something which, if that is your mission in life, should not be, judged by anyone else, as long
Yeah,
as you're
yeah.
following a legal option. The ethics are up to you and your
Yeah,
own
yeah.
internal code.
Okay.
I would not work with an agency in India simply because I would want to know that the women were getting what they deserved, and we would need to be running that facility ourselves in order to feel good about it. So our
I see.
agency runs a program called My Surrogacy Family, and that's here in Hawaii.
I see.
And we're
Okay.
just starting out. Like I said, we've been starting it, researching it, developing it for about 2 years, and we're just now taking our first family clients.
Oh, wow, interesting. Well, really, I'm sure the audience members would, hearing this, would appreciate the kind of care and responsibility that you take into consideration in dealing with the surrogacy.
I hope so. I mean, we
yeah.
want to feel good about the work we're doing.
That's right, yeah. So before we close, can you maybe you use less than 2 minutes to summarize the pros and cons of surrogacy, especially in the case we're talking about surrogacy in India?
Sure. I think as a prospective family, you have to look at why you are choosing to do surrogacy and what matters to you, the care that the surrogate mother would be receiving, her rights. But also there's the very real issue of money, and the cost of surrogacy in India is a third what it is in the US, typically. Not always, though. There may be many attempts at pregnancy that take place if you have to go to India. Things might not go as well. The medical technology might not be as good as what you're getting here. I think it's a very personal decision, and I think you do your research, you understand what your limits are, you set your budget, and then you go into it trusting and open and honest, and ideally aware that the woman who is helping you is changing your life, and you owe her a lifelong debt of gratitude.
Wow. Again, a very fascinating, mind-boggling, challenging topic, surrogates in India. And thank you so much, Kristine, for joining us.
Thank you.
And this is ThinkTech Asia. I'm your host, Hong Jiang, and we've been speaking in the last hour also with Kristine Altwies, Executive Director and CEO at Hawaii International Child, about the issue of surrogates in India. And thank you so much for tuning in. And I want to thank our production team here at ThinkTech Hawaii. Production Manager Ian Davison, Communications Director Chrissy Golfigan, and our producer Jay Fidel. And of course, I thank you, the viewers, for your support. I'll see you next Tuesday at ThinkTech Asia. Thank you and goodbye.